Hi everyone, it's Dr. Jhawar with Revive MD, Direct Primary Care. I'm often asked about cholesterol levels and what they actually mean. And since we're talking about heart disease and Heart Health Month this month, I thought it would be something important to address. Recently, I had a very close friend call me to go over her cholesterol results that she had gotten from her doctor's office. She was told that her cholesterol was high and that she needed to exercise more and reduce fatty foods in her diet. Well, that's kind of difficult to do for somebody who, trains for marathons and she exercises quite often and she already eats very healthy meals. So I told her to, go over the report with me. Many times, and this is not uncommon, patients and doctors will look at that first line on the cholesterol report that says total cholesterol, and that's kind of where we stop. So I have a problem with that because total cholesterol is not the full story. That just tells you what the total is, which is good cholesterol and bad cholesterol. So the problem is that we don't know how much is good and how much is bad. To me, what's more valuable is to look at the numbers below the total cholesterol, looking at what the good cholesterol is and what are the bad cholesterol numbers. And then figuring out with the patient based on their risk factors like their age, their sex, what other chronic conditions they have, if they're smokers, and other things to determine what their goals for their cholesterol should be. The lab gives us some reference ranges that are also on a lab report, but those are very generic, and I tell patients, not to look at those as sort of the gold standard, but to actually have a discussion with me about where they should be in terms of their cholesterol levels. When we talk about, good cholesterol and bad cholesterol on a cholesterol panel report, we're talking about HDL, which is your good cholesterol, and then LDL and triglycerides, which are your bad cholesterols. So I hope this helps, you all to figure out with your own primary care doctors how to really sit down and have this discussion about what high cholesterol really means and to go beyond looking at just the total cholesterol. It's Heart Health Month, so I think this is a very important topic. And if you don't have a primary care doctor, please feel free to call me and ask about my practice, but I would be more than happy to have patients join the practice and learn more about, their cholesterol levels and be proactive about preventing heart disease. I'll be back with more videos and stay tuned for more.